Welcome. We're back in Wisconsin Rapids again, and my name is Kevin Ferreira.
I'm Shannon.
And today we have Megan with us. We're going to talk about a very interesting topic, and a topic we don't talk about very much, the one of female rejuvenation.
Women's health is grossly underserved topic and underserved healthcare aspect in, I think, everywhere.
Yep. And that's underserved for a couple of reasons. It's underserved because it's probably undermanned and we don't have the amount of healthcare provider for the sheer demand. And number two, a lot of the women's health issues are not well publicized, and the solutions, many women do not know about these solutions. And I hope this video brings some of the problems and the solutions to the fore.
I believe, and so does Kevin, I think that there's a lot of misinformation out there, and there's a lot of things that happen to women that kind of get pushed off as normal or something you just have to live with or deal with. And there's a lot of things that we can do that are relatively simple to fix a lot of those problems.
So with our women's health rejuvenation, we do a combination therapy here. We use a CO2 laser in conjunction with platelet-rich fibrin. A lot of providers use platelet-rich plasma, and they have gotten some benefits. We used to use that too, but we are more comfortable using platelet-rich fibrin as our stimulant for collagen and also the CO2 laser. And when we use them together, we get this synergistic effect that our customers do like. We are here to go on a journey here with Megan today, and we see where we get with it. I've been called a few times since this year, 2024.
I would say the most calls since we've been doing aesthetics is this year.
Yes, yeah. we have had a CO2 laser for 4 years, and we probably did about 4 or 5 female rejuvenation. But since this year of 2024, we have had a lot of calls, and all over Wisconsin, and some people even northern Illinois found us down in Middleton area. We feel it necessary to talk a little bit about the female rejuvenation and what we have to offer. We usually do a combination therapy, as I say, with CO2 laser and platelet-rich fibrin. We address a few issues in the women's genital urinary area.
You know, I intentionally have had conversations to get a feel for the public in our area, and what I realize is a lot of women think that chronic dryness, frequent UTIs, yeast infections, mild incontinence, painful intercourse are things that they just have to deal with or are common or get brushed off, like maybe try a topical. If that doesn't work, then like you're just aging, or that's normal after kids, or like all these types of things, and answers aren't satisfactory and don't solve the problem. And some of these things that aren't well talked about when you go into the clinic are some of the things that we're going to talk about today.
Yeah, we intend to talk about some of those subjects and also talk about the solutions. We have done talks on CO2 laser already. So briefly, what the CO2 laser does, it sees water underneath the skin, and we use CO2 to ablate the skin and help it rejuvenate in a more normal way. So that skin has better functionality, better sensitivity, and even a better aesthetic look when you get right down to the cell to cell. That's what CO2 does. We have a specific vaginal probe for our raw CO2 laser. The procedure is usually about, less than 5 minutes actually. The prep time and talking to the patient can take hours, because today we have done a detailed history with Megan. She's just here to do a synopsis of the big stuff, but we have done a detailed history. We have done a physical examination, and we have ruled out all the situations that would make our procedure not possible today. Because there are a few things to rule out when we evaluate a patient. We take a detailed history. We want to know about the genital urinary history, the amount of children they have had, and any complications, any heavy babies, anything like that we would want to know. We would want to know about any types of infection or ongoing infection. Actually, an infection at the time of procedure would be a contraindication for that type of procedure. We also want to know if the patient has tried anything and her hormonal status. Is she perimenopausal? Is she still having periods? Those are important information, because as Shannon mentioned, some of the symptoms she just mentioned, like dryness, could be caused by other issues, But from a rejuvenation point of view, I've never seen anybody that the CO2 and the PRF hasn't helped, So even if they're perimenopausal and they probably need some hormonal therapy, this thing still can help, because this is a natural way to really rejuvenate. And some of the structural issues that she touched on, like urinary incontinence, all you need is a CO2 to restructure to get better results.
These things are not in lieu or instead of other therapies and treatments that are currently are practiced. They're just an option to do along with. It's an adjunct therapy, and it's something that can reverse a chronic issue that's been going on.
So we spoke about the CO2 laser. The next arm of our therapy is PRF, platelet-rich fibrin. So platelet-rich fibrin is a concentration high in platelets and fibrin, so that those platelets are activated, and platelets are known to start the healing process. So that start the rejuvenated process, that start the collagen building, that start the new vessel formation, the new nerve formation, that start the restructuring of the tissues in that area. So we think a CO2 with PRF married together is a wonderful synergistic treatment to get maximum results for the client.
And so a lot of the things that we just discussed are related to a dysfunctional or not healthy tissue. And so that's why these things can make that tissue healthy again, correct the pH, improve the dryness because of new blood vessels and new tissue formation. And that's the aim of the procedure today.
That would improve sensitivity and also decrease the risk of frequent urinary tract infections, and also a better aesthetic look, making a client feeling more confident and everything that goes with that. So the Vivigen, or the Vivigal genital rejuvenation, as I just said, is with PRF and the CO2 laser. So that process involves a detailed history where we go through a detailed medication, all the patient's medical issues, and we see if it's right for them. We also talk about the other things that can be causing what particular symptom that client might be having, and we urge them to get lab tests to get evaluated, or we try the Vivigal Gen procedure and see if this helps them. We usually recommend 3 to 5 procedure. It depends on the youth of the client. A 30-year-old client might respond with 1 procedure. A 50-year-old who has 5 children, smoking, other issues with toxic burdens, those people might require more procedures. Somebody with hormonal issues, would need help with hormones and the procedure.
And a good message too, if there's many things our OBGYN and primary care can offer, and sometimes we need to add in some functional medicine and add in some aesthetic things, and so that's kind of the aim. We're not excluding anything, we're just looking at the whole picture and all the options out there.
So with all of this, for one thing a client should be doing, they should be doing the Kegels exercises, pelvic floor strength, that helps everything with the procedure, with recovering from the procedure, and also going forward. We like to promote a healthy diet, one with good collagen, not only when we have the procedure building collagen, but also after the procedure.
Hydration is important. Making sure we're getting micronutrients is important.
And we also suggest that the client would desist from activities that would cause collagen degradation or rapid collagen degradation.
So we make sure that she's comfortable. We make sure that there's no anxiety or apprehension, just like any other procedure. So however long it takes to have conversations to make sure that she understands the procedure, well educated, and then we go forward with the procedure. And sometimes, people will call and they need another week, or they need another talk, or whatever it needs to be. We just give them that.
We try to make the patient comfortable in any which way we can.
And then procedure-wise comfort, topical numbing. The gas is available if there's an anxiety issue, that can sometimes help. And then of course anxiety medication itself is also an option if needed, because this is an intimate procedure and it can be a little bit nervy. We end up touching areas that don't normally get touched even when you go to primary care or your OBGYN, just because of some of the areas that we're trying to stimulate and rejuvenate. That's a conversation that needs to be had as well.
We could get a client in within, I would say, an hour, hour and a quarter, hour and a half for the total procedure in between.
The interview, the history, the prep, and then the actual exposure time where that area is exposed is less than 5 minutes. That's always important for people to know, I think, just because the idea of coming in for something like this is I don't want to have that out, but just know that it's not that bad.
And as I said, we do everything for our client to be comfortable. The last
Whether it's
client,
karaoke.
We have had karaoke here. We have also had clients bringing in their friends.
Friends are important. That's helpful.
That made them feel comfortable. All of them that we have had, the ones that need more, they don't have a hesitation to do a second one when they realize how quick, simple, professional,
and not as painful as they thought it was going to be.
Yeah.
Post-procedure, the expectation.
We want you to do your Kegels because we use PRF. We suggest no non-steroid anti-inflammatory. No sexual intercourse for 4 days. Moisturize and stimulate the area would be very important.
Typically what happens is we just wait the 24 36-ish hours, and then you can start like some stimulation exercises. Great way to moisturize is coconut oil. It's natural, but it also like the moisture stays there a long time, so that's just a good habit. Use it for cleaning and for moisturizing.
Yeah, that's a quick overview of the procedure. I'm sure we left stuff out, and please remember, this is to rejuvenate. Sometimes people have underlying medical issues that we have to address. We try to address those when we talk initially and create the expectations. This is a wonderful add-on to help to address a lot of problems which people don't know that there are solutions to.
To get the point across that the treatments are really short and really not that complex, but they just fix, like, you don't have to be dry, you don't have to have the painful sex, you don't have to have the chronic UTIs, and these things are just ongoing for women, and they a lot of times get brushed off and they're ongoing. This is mostly to spread awareness. So if you have questions or comments or concerns, or we missed something, you know, you can put them in the comments. We're happy to start conversations. You can text us here or follow any of the social platforms here. All right, so Megan, we're so happy that you're here and so happy that you're willing to talk about this topic that is both sensitive and, you know, just not talked about enough.
Thank you. I'm excited to be here.
Brave of you, very brave of you, but if this helped 5 or 10 people, I mean, would have done our job here today. Thanks for coming. So what are some of the issues?
A lot of the things you listed before, I am experiencing. I'm experiencing dryness, UTIs, reoccurring, and then I am usually prescribed an antibiotic, and then the antibiotic goes through a constant cycle of a yeast infection, and then I'm put on a medication for that, and it just seems to keep happening.
So how long has this been an issue for you?
I would say I'm now going on almost a year, and it's been very difficult because I'm working on, you know, my health, and my health is with my body, my mind, my mental, and it's very...
And this can, you know, I'm happy you touch on that, because this can affect a client in so many far-reaching ways, you know, in terms of confidence and mental health and all of that.
When we talk about whole health, it's the whole thing, and this is a big piece of it. I mean, it's in Maslow's hierarchy of needs, you know, to make sure that that's taken care of.
So what have you done so far?
As far as, well, the antibiotics,
Wait,
but anything else that you've tried as far as any procedures, or what is your feedback from the people you've been seeing?
Some of the suggestions from other people have been to put moisturizing like pearls, and when I take them, it throws off my pH. And that's another issue that I struggle with, because then when I'm on those things that are supposed to be helping with dryness are actually now causing another issue of a yeast infection, and then I go through these constant cycles.
Yeah, we understand, and your story is very, very typical, because if we're truthful, that's the story we heard most this year. Yeah. Apart from, you know, some other folks, but you still complain of dryness, because, you know, and dryness, I would say, is one of the number one. Painful intimacy is another one that's high up there, you know.
Yes, because when you're starting to feel dry, then you're starting to not want to be intimate, and then it's mental again.
And you know, I think it really hit me when I was having a conversation with a large group of women, and I was talking about this particular thing that we do, and the consensus of the group was just like, oh yeah, well that's normal to, you know, be dry and have painful sex, and like that's just the norm. And I'm like, that's not the norm.
And I've asked for help of guidance of what can be done about this. Surely I'm not the only one going through.
And there is a lot of things out there. And there are a lot of things that do help, but when you run into nothing's helping, then the problem is just different, and it doesn't mean that it can't be solved and it can't be fixed.
A lot of people think we just have to live with this, you know. That's far from the truth. There's lots of things we can do, namely PRF, CO2 laser, PRP, you know, all of that helps.
And just like we've talked about so many times in our videos is, we're using the body to fix itself. So we're, like when we're using PRF, we're just concentrating it and delivering this blood flow that doesn't get good blood flow to an area that can really be rejuvenated and start the healing process by delivering it to there. And when we talk about the CO2 laser, the same thing, it's collagen induction therapy. And so when you're building new tissue in that area, that new tissue is healthy and comes with the blood vessels and comes with new nerves and comes with moisture.
And I was looking for something that would be a natural approach, and this just seems to be checking every box.
Yes, and that's the problem, because these kind of therapy is not available in every town or every street corner, and that's why we have to get the awareness out there, and also hopefully more practitioners would want to do this, in their offices, because this helps a lot of people.
Yes, I've been looking for a place to have something like this done, and we're at the WEN facility with Wow Aesthetics, and I am really excited to be on my best health that I can be in at age 41.
I know, and you look amazing, and so you want to feel amazing.
And I've been taking care of, my aesthetics, and I'm now on to this next step of my journey that I'm really excited to see results.
Me too. I'm excited and I'm confident that we can.
And I'm happy to be on this journey with you, and we want to commend you again for being so brave to talk about this and talk about the issues that are affecting so many people. But I must say, since 2024, we've been getting a lot of calls, so hopefully more people will see this and, raise more awareness of what we can do to solve issues of incontinence,
And don't accept that there's not an answer for something.
You have any questions for us?
Okay, so when you say it's not painful, it's really not painful.
Okay, so there's two things happening. The first thing is the CO2 laser. The walls of the vagina respond to stretch, not so much the touch and the poke. So you're not going to feel that. What you feel is very, very high up is the CO2 laser itself is going to, do the laser job, but you're not going to feel any of that. And with every single client we've had, that's a true statement. And then the injections, what we have you numbing up right now in preparation for that. So sometimes people will feel a little bit of pressure, a little bit of burn. The longer we can numb, the better that is. So you can take down that anxiety about, the laser is not painful at all. And then these injections are just going to be managed with.
Is there discomfort after the procedure?
You could get some when the numbing medication is over, but we have done, multiple needle sticks in your face. It shouldn't be more than that. Actually, it should be less than that. So it would be like you got multiple needle stick in your face from Botox or one of those kind of treatments. We use 4 to 5 cc's of PRF, and the CO2 laser, we go to the deepest part first, and we go in a circumferential manner. So every area we do it in 6. We divide a circle into 6 parts, and we go around, and then we pull out a centimeter and go around again and pull out a centimeter till we're out, and then we inject the PRF and we're done. And that's 3 minutes tops.
And then you're going to be numb for the rest of the day, pretty much down there, which can feel strange, but it will come back. All of it comes back.
I promise it will come back.
And then how long does it take to feel any?
So great question. Great question. So everybody's a little bit different.
Some people is right away. That I was saying, the younger clients right away, and they don't need more. But it depends on what you have. If you have what I've seen, if you have a structural issue like from incontinence, that kind of thing, you need more than one. If somebody just doing it for rejuvenation and to feel more intimately, probably one is good enough. That's what I'm seeing.
So depending on the problem that we're trying to solve. So PRF can work very quickly when we're talking about stimulation, and when we talk about sexual health, you're going to feel things like being able to achieve the climax faster, better, longer, those types of things. Those are the feedback we get as far as sex goes. And then when you talk about moisture, that will come a little bit later because we're waiting for the tissue to regenerate. So it's kind of like looking at the thing we're doing and how long that takes. So tissue regeneration takes a little longer. So that's talking about the moisture and the incontinence issue. And then the pH correction is a combination of those things. So hopefully relatively in a couple of weeks, we'll see the correction in that.
I've never seen anybody that this does not make some improvement. You know what I'm saying? The type of improvement depends on the client, you know. The male side is true. I mean, if we do PRF for hair injection, that's true. You know what I'm saying? And this year we're doing a synergistic, you know, combination with CO2 and PRF to get our results. And I know you're living the good life too. You taking your collagen, you're taking your vitamin C, you're taking your regular IV doses of vitamins, you're taking your cleanse once a year. So all of that will improve. It will improve the results and make it robust.
We've looked at hormones, all that stuff. So you're in the right spot and we're at the right place to do this.
Let's get this done, and we'll be following Megan's journey through this whole process, and we'll have a few more videos down the road with this from time to time.
I'm Shannon.
And I'm Kevin.
And I'm Megan.
And this is Wow Aesthetics. Remember, we meet you where you are.
In and out, deep breath.
You good?
Feel okay?
All right,
Okay.
we're gonna start now. All right, 1, 2, 3. I'm gonna begin now. 1, 2, 3. How is that?
I didn't feel a thing.
Okay.
So that is the internal CO2 laser. She said she didn't feel a thing. And so just before we started, I had mentioned we were going to do the internal CO2, then we do the PRF injections, and then we come back and do the external CO2, and the whole procedure is going to be just a couple of minutes.
Very nice. All right, first trip down.
She said no pain. And we're seconds from going into the injections. And then while Kevin is doing the injections, we're gonna switch the laser to the external piece, and then we'll jump right back into that. All right.
Megan, you did very, very good. Done with that. All right, so we're gonna hurry up and leave now. There's some injections there. All right, so this is where you're gonna get touch some places that you've never been touched before, but we'll hang in there, we'll get it, okay? 1, 2, 3, small poke. Small poke, you're good. Yeah, you're good. We're gonna do the external laser.
You won't feel this.
Sorry. All right, my part is done, okay? Yeah, it was a very good treatment. So we'll just follow you through this and then see how you do then. Hey, thanks for being brave, my friend. Like coconut oil, yeah, just stimulate, yeah. That's the only thing you need to do. Only thing. Keep your hair clean, coconut oil, you know.
I just wanted to give an update on how my vaginal rejuvenation and PRP injection went. So I would say the process took about 5 minutes all in all. From there, it started to have a slight stinging sensation, almost like a mild sunburn. Immediately afterward, I was able to do some light walking and some light lifting. The day after the procedure, it started to sting a little bit more than the first day, but very tolerable. On day 2, I would say I had some mild cramping and some spot bleeding. The next day, I would say it felt pretty tolerable, mild cramping. Everything from there just started to improve significantly, and I'm very happy with my results.